Well, hi now. As promised, we're joined by Dr. John Crary. He is a professor neuropathology at the Icahn School of Medicine at Mount Sinai Hospital. He's the co-director of the Brain Bank with specialties in neurodegenerative diseases like Alzheimer's, dementia, and the connections to CTE, a subject near and dear to my heart if you watch this podcast very often. Doctor, welcome.
Yeah, Randy, thanks so much for having me.
It's really a pleasure, and I was really looking forward to talking to you because I really make a concerted effort to try to stay up as much as I can on this subject, and I think it's something that people don't hear enough about. They get it in spits and fits, if you will, but as far as what's going on in the field, neuropathology-wise, when it comes to some of these diseases, there's been a lot of progress in the last year or so, hasn't there?
Yeah, indeed, really has.
And from your position, I know you recently had a study you came out with that featured the connections possibly between Alzheimer's, dementia, and CTE.
So just to start, I think it is really important to engage with the general public about the research. It can be very unapproachable, and there's clearly a lot of misconceptions about what exactly is occurring in the medical literature, and this gives us a great opportunity to kind of address them. Certainly there is this misconception that the scientific evidence linking CTE, brain injury to CTE and contact sports is not strong. I think it's definitely worth, talking about that because there are a lot of studies, some of this work that I'm doing, which hasn't been published yet, as well as previous work that we have published looking at age-related changes is definitely worth discussing.
Right.
But in terms of, what's happened, recently, one of the major misconceptions is that the evidence is not strong linking sports to contact sports to brain injury, which is not the case. So, for example, I want to point to the MES study. This came out in JAMA. Did you see this? This was at the end. Of course,
Yes.
Everybody was talking about it. At the end of 2017. It's about a year ago. They studied 202 deceased American football players, and they found evidence, and this is neuropathological evidence, this is a direct examination of the brain, the evidence of CTE in 177 of those players. And that's 87% of them. And that's an exceptionally strong link. And this is not just one group that's showing this. There are others as well, right? So, for example, the Mayo Clinic has a similar study where they screened their brain bank and found CTE in 32% of all their contact sports athletes. And so just in the past, year and a half, the evidence has become kind of incontrovertibly strong that there's a link here.
I was going to say, when you look at that, I know the early concept for a lot of people made it really easy for them to think about. They saw the movie and they think concussion. And they go, well, it's got to be concussions, what this linked to. And the thing that really interests me over the last few years, or one of the specific points, is that it's those repetitive blows, more of the minor blows that now they're starting to look at, that a lot of that comes from.
Yeah, so I kind of view this as sort of a measurement error. As scientists, we get very hung up in exactly what we're talking about and how exactly did you measure something. And a lot of the tools that clinicians use to assess injury are very blunt, right? So what exactly is a concussion? How do you define it? Kind of operationally, what we think of is a mechanical force, external, being applied to the brain substance, leading to deformations in the brain tissue. Those forces stretch, compress, and shear kind of structures when they happen. And we think that there's a certain amount of resilience in the brain, right? But we don't know exactly how much a brain can withstand, especially when it's mild. And some of these symptoms of concussion are variable, right? And so if you don't actually lose consciousness, can you really call it a concussion? And I guess it all kind of depends on your perspective. But yeah, the repetitive nature seems to be a problem, and that's actually really important in the way that we think about whether or not the mechanical injury is causal. And I'll tell you why. Because we do know there's a very strong link between the years of engagement in contact sports and the likelihood of getting CTE and the severity of it. And that dosage effect really helps us to understand that causality, to show that there's that linear relationship is really helpful.
Well, another thing in the last year that I was, I guess, not mildly, but pretty aggressively concerned about is certain books have come out ripping studies that are done or discounting studies that are done, saying that there's almost like a vested interest in people wanting to promote the fact that football is evil and contact sports are evil. That's not really the case. I mean, you talk about history of these kind of things. I remember as a little kid watching boxing with my dad and listening to boxing on the radio. And there would be an older boxer, usually as a commentator, who really didn't speak too well. And I'd ask my dad, how come he talks so funny? And my dad goes, he's been hit in the head a lot. He probably, it's just sort of boxers are like that. Well, wasn't that right in front of us the whole time with boxers?
Yeah, I think when we when we start to ask questions about causality, this kind of plausibility is super important. It just fits in with the way that we perceive the world. It's not a surprise that mechanical injury to the brain will cause damage, and that there could be a short or a long-term effect. When it comes time to assess some of these books that are out there, I realize that emotions are running high, and there's a reason for that, and I kind of get it. Although I'm not from a football family, I really have very little interest in football at all. But I do kind of see that it's become kind of synonymous with being American in some communities, and it's really a way of life. And it's hard for people to stomach that there might be negative consequences to something that was such a positive in their lives overall. But in terms of the scientists, the serious scientists who are out there, there's really no question. The major scientists in the field, for example, Dan Pearl, he's a professor, director of CTE research at the Department of Defense. He oversees all of these long-term TBI studies. And I'm quoting here, he says, CTE is only seen in the setting of repeated head trauma. At the end of the day, this is produced by head trauma. I'm sorry, that's what all the research says. Other major institutes, Walter Koroshetz, he's the director of the National Institute of Neurological Disorders and Stroke, which is part of the National Institutes of Health. And I'm quoting, I don't think there's any wiggle room. It's pretty clear this is due to head injury. Whether there are other things involved and when it starts, that's hard to know. But I don't think there's any question it's related to head injury. If you look at the CDC, they put out a heads-up brain injury questionnaire talking about CTE. And I can quote them too. CTE is a degenerative disease associated with changes and deficits in cognition, behavior, mood, and motor skills. It's believed to be caused in part by exposure to repetitive head impacts, including concussions as well as subconcussive trauma, as we were mentioning before. So these are probably the groups that are in the best position to talk about what's happening here. So you have to take all the other, books and the lay press as with a grain of salt.
Yeah, are there any things to be drawn from an experience of having a heavy experience in contact sports? Let's say myself, I played 21 years of football total.
Yeah.
High school, college, pro. And it's always the excuse if I talk about I've got a headache or I'm getting forgetful or I'm whatever, it's always, well, you're getting old.
Yeah.
That the whole cause and effect is primarily just related to aging, and that almost has become an accepted, almost like a cliche for people, that supposedly as you age, that just is what's going to happen.
Yeah. So aging is super interesting, and I've spent a lot of time working on it. What my focus, what I'm kind of known for in my field is a disease we call primary age-related tauopathy. I think it may be important to kind of take a step back to put all of this stuff into perspective, and maybe talk a little bit about these symptoms. That we talk about, for example, dementia. Which can be really confusing, as well as some of the other symptoms that are related to the brain as people age. But what I found when I start to talk to people about brain disease is that there's a lot of confusion about what exactly dementia is and how it's related to Alzheimer's disease, how it's related to CTE. So if you have time, we can
Sure.
talk about it.
Sure.
So dementia, it's really important for people to recognize that it's a group of symptoms that you see together, and it includes problems with memory, attention, your ability to plan, we call that executive function, and some language function, word finding problems. So, for example, it's just one of the many symptoms associated with the brain. For example, movement disorders is one thing, psychiatric, depression, psychiatric sorts of things. It's also a paralysis is another brain symptom you get with ALS, which is related in some way. But it's a symptom, and it's a symptom just like any other symptom. For example, trouble breathing, which I think is a great analogy. It's quite obvious to you and me and to everybody that folks can have trouble breathing for a lot of different reasons. For example, choking on something that blocks the airway would cause trouble breathing, just like pneumonia might cause trouble breathing, which is a lung infection. Or somebody has asthma, which is an inflammatory disease in the lungs, or even a heart attack can cause trouble breathing. It's very clear these are very different causes, and they would be treated very differently. The reason why people get confused about Alzheimer's dementia is because it's thought to be the most common cause of dementia. And so it's convenient kind of operationally whenever anybody has those symptoms to say, this is just Alzheimer's disease. The analogy that I like here is the Xerox machine. When I was a kid, every photocopier was called the Xerox machine.
Right.
Because they were the most common, right?
Mm-hmm.
But now we have all these other, machines. Xerox doesn't even exist anymore. So that, doesn't happen. And what we did was we started to split things up. And it's really helpful. And there's a lot of progress that can be made by splitting up the different causes of dementia. So Alzheimer's is one, but vascular disease, cerebrovascular disease is another. People can have strokes and not getting enough blood to the brain. There's something called diffuse Lewy body disease, which Robin Williams had, which is very important. There's a disease that I work on, primary age-related tauopathy, frontotemporal dementia, and the list goes on and on and on and on.
Mm-hmm.
But by glossing over the distinction, we're losing a lot of this complexity. For example, CTE patients had been getting lumped in with Alzheimer's disease, and we weren't able to talk about those symptoms differently. And by paying attention to it, now we can recognize them better, and we're working on ways to split these patients up. And if we can split patients up into subgroups, then we can move into the era of what cancer biologists calls personalized medicine. And I think cancer is a great analogy. I'll tell you why.
Mm-hmm.
Because nobody talks about the cure for cancer anymore. You would kind of be laughed out of a conference if I said I had the cure for cancer, right? Why is that? Well, we recognize that there are hundreds of different types of cancer, and actually every individual cancer has a unique genetic component to it. And so what we're able to do by recognizing that and trying to understand it, we can develop tailored treatments to individuals. And so what we're seeing with the brain diseases is that there are differences, but there are commonalities, but also differences that can be addressed. And so now when you have an individual who says to me, I have some cognitive impairment, we can then use what we have scientifically, the new tools to, for example, biomarkers, to really get at that root cause and then make recommendations based on that.
Mm. Yeah, for instance, ALS, I played for a team, San Francisco 49ers in the NFL, and over the course of the last probably 40, 50 years, we've had 6 or 7 players pass away of ALS. Most recently, Dwight Clark, famous for the catch back against Dallas in January of '82, passed away from ALS. And people now want to lump everything in together. And from what I'm hearing from you is that's just sort of dangerous to say, ALS does not belong right next to CTE. I mean, they may be a neurodegenerative type disease, but they all have singular footprints.
Yeah. Well, the tricky thing is that there's broad overlap, and we could talk about that a little bit. There's overlap in the symptomatology, and there's overlap in the molecular and cellular changes, what I call neuropathology. So when the things overlap, that's where the confusion comes from. So on the one hand, we're going to work towards splitting, because the splitting allows us to find unique drivers, causes. Is it genetic? Is it environmental? Is it toxins? These sorts of things. But we're also working towards that common thread that links all of these degenerative diseases together. ALS is a fascinating example. There's been a lot of progress in ALS research in the past 10, 20 years. They've been very good using genetics and genomics, very good at finding these kind of internal risk factors based on DNA. But the tricky thing is we're seeing in military veterans and athletes kind of alarming increase in the amount of people who have this syndrome, this pattern of paralysis and damage to the spinal cord. And so we wonder, it's always nature and nurture, right? We always wonder if there's some kind of environmental risk for it, and that's what people are working on, right? And it's plausible, right? That's one of the things that makes sense is some of these workouts you went through it. I don't think I would ever survive some of these workouts, but there's probably a lot of mechanical force that are getting applied to the nerves, right? As you get blows, and I don't know, maybe even just some of the aerobic exercises too. I really don't know, but I could imagine that somebody might be vulnerable and put at risk. So there's a lot to look at there. One thing I'd just like to point out, which I think is so fascinating, and it brings up a key problem, is Lou Gehrig, who this disease is named after.
Right.
We call it ALS, amyotrophic lateral sclerosis, but the common name is Lou Gehrig's disease. Lou Gehrig played baseball, but he had many documented concussions. With loss of consciousness, he would get hit in the head with balls. That happened many times. And he also played football when he was an undergraduate at Columbia University, which you're probably aware of. And so we wondered whether he didn't have this garden variety ALS, or maybe he had a version that was related to sports. The problem is they never did an autopsy, so we will never get that piece of information. But it is interesting to think about that.
Here in Atlanta, there's a very big football game this week. And if you had a chance to send a message, not only to sort of the media, the players or whoever, but just the public at large about this greater issue, what would it be? Well,
the bigger issue is related to participation in research. The scientists are your allies, and we're doing this not with an agenda. We're doing this because we want to make a difference. Most of these scientists get paid terribly. They work extremely long hours. I look at my friends who've gone into business and wonder why I didn't take the same route. We're on your side, and we need research volunteers. The other thing that I tell everybody is research needs more funding. We can maybe talk about this. You had brought this up in your email previously. Where are we getting the money to do this? It is rather expensive. And Alzheimer's and neurodegenerative disease research is starting to see an uptick, but we're still the NIH and government budgets dedicated to this sort of stuff pale in comparison to what we had before. So I would encourage you to, if you wanted to actually do something, I would put pressure on your legislators to increase funding for these sorts of projects.
How much of this now, especially when it comes to the concussion side and the direct effects of these repetitive blows and concussive force and whatnot, is a lion's share of this research being done out of the Department of Defense, seeing they do have such a huge vested interest in this?
So let me tell you, I was looking at the budgets recently. The total NIH budget, National Institutes of Health budget, is $39 billion, and that's going to be for fiscal year 2019.
Wow.
And it's been expanding. The Department of Defense budget is $1.3 trillion for fiscal year 2019. So the DoD budget, eclipses the NIH by a lot. However, the amount of money that they're spending on medical research is just a small fraction of it. The congressionally directed medical research program is $1.6 billion. And that includes funding for Alzheimer's disease, Parkinson's disease, ALS, but it's just a fraction of that. And you can find all the information about where they spend the money on the web, cdmrp.army.mil, and they have the funding history listed out. The other place where money for this sorts of research comes from is pharmaceutical companies, and that can't be ignored. So pharma spent surveys say about $71 billion in R&D in 2017. But this includes every type of clinical trial that they're running. But it doesn't really help so much for these neurodegenerative diseases because we're still struggling at the very basic level of understanding what the pathways are that need to be targeted with drugs, right? So pharma wants to develop drugs, and they want us to tell them what the drugs should go after. Now, until we get real funding, significant funding in CTE-related projects, we're not going to have that much information. We're not going to have the answers. So I recently went to the NIH website, and if you have any interest, this is kind of fun. Okay. You can find this online database called NIH Reporter, and it tells you all the grants that have been given out and which institution and who the leads are, and they have descriptions of what the projects are. You can type in any disease you want. And when I put in CTE, only about $32 million of the total $39 billion is going to projects that mention the word CTE. And most of these projects just peripherally mention that what they're doing might help CTE. Real projects that are focused on CTE are very small, just a small handful of labs that are doing it. So I think we really need to invest heavily in CTE research. It's just not happening right now.
That's fantastic. Hey, Doctor, I really appreciate you taking the time to do this. I look forward to perhaps seeing you in person down here in Atlanta at the neuropathology meetings. I would love to come down and sit in the back of the room and try to absorb some knowledge.
Yeah, love to have you.
All righty. Thank you so much. Really appreciate it.
Have a great day. Bye-bye.
Bye-bye.